big cheerleader, big fan. He's helping us out with so much of the legislation. Oh my gosh, we're on the other side. All right, so I'm going to give it over to you, Mike, and you can, you're going to let us know about blazing the trail, which you are much a trailblazer. So thank you so much.
Welcome everyone. I'm glad that you're here yet again. I'm sorry that you have to be here yet again. But the legislative process is a slow and torturous one, and as we're all finding out, some people know that from experience. I guess we're starting to learn, we're all learning that from experience. So I just wanted to introduce one of my colleagues, Representative Sarah Kidd. Sarah represents Norwalk, Fairfield and Trumbull. There we go, Fairfield and Trumbull. So, a couple things. I guess I'm supposed to talk about blazing the trail. Really, it's all of you who have blazed the trail for all of us. You have blazed the trail for years. And I want to let you know this, because sometimes we get discouraged. Sometimes you feel like we're not making any progress. I am here to tell you that you are making significant progress. We've made progress in the last several years just by bringing attention to our fellow legislators, by bringing attention to the governor's office of the many inequities and the many unfair practices and the many issues that need attention that have been ignored. So you are ignored no longer because of your advocacy, because of what you're doing here today, making noise and bringing issues to people's attention. So you are actually blazing the trail. And I know all of you are going to talk about different issues today. The one, should I talk about specific issues here, Maureen? Maybe not. Should I talk about specific issues? Okay. I don't want to monopolize everybody's time. What I do want to say, since Representative Kidd is right here, we had a good idea very recently. And the good idea is to follow our colleagues, many of whom form different caucuses of legislators in this building. And our idea, we are just initiating it, is to start a Disability Rights Caucus. And we are going to be loud and we are going to be persistent. And with your help, we're going to get the attention of our fellow legislators and the governor, and we're going to make some progress. So there are many issues in front of the legislation this year: supporting decision making, making sure that community first choice is protected and kept alive, making sure that accessible medical equipment is made available, and then to the discrimination in Husky C determinations and eligibility, making sure that the wheelchair repair advisory council recommendations are put into law. There are a whole host of issues. I think I hit the top ones. So, again, your advocacy is what is getting this done, and don't stop. Don't stop and don't get discouraged. And now you're going to have a caucus of legislators. A caucus of legislators to push this stuff through. It won't happen as quickly as you want it to happen, but it is going to happen. I'm going to turn it over to Representative Kidd.
Thank you, Representative Demicco. I just want to echo his thoughts here. It's going to be a long, hard slog. Disability community has been largely ignored by all levels of government, local, state, and federal, and Mike and I are committed to this work. And if we don't get everything this session, we will be back next
Oh, thanks. We got a brother. Yes, so the big question on everyone's list right now, fear into a lot of our hearts, whether we're great age, and it affects me because that's my future, that's people's present, what's going to happen in the next year or so. And talking specifically about community first choice is a powerhouse team. We've got Mary Caruso and her children, Sam and Alex Bodie, and they are going to talk to you about community first choice and its impact on the community. So thank you so much.
I'm not the only one. Just trying to make sure I got the interpreter.
Testing.
Thank you, Sheldon. Good afternoon, and thank you for being here today. My name is Mary, and I'm here a proud parent of these two incredible people, Sam and Alex, who live with Friedreich's ataxia, a rare progressive disease that affects mobility and independence over time. They were born without any signs, and then one day, when Sam was around 8, it appeared and never stopped. Alex shortly after. As a parent, you spend your life hoping your children will grow into who they're meant to be. But with a disease like this, there are moments when you wonder what will be taken and what future looks like. What Friedreich's ataxia has taken from them, Community First Choice has helped give back. Because of CFC, they're able to live in our home, in their community where they choose. They're able to work, contribute, build relationships, and live with purpose. Alex, a social worker, runs her own nonprofit focused on accessibility and helping others in the community. Sam has a background in communications and supports young people at our local high school. CFC has given them the tools to make that possible. We respect the role of the state and the responsibility to ensure these programs are administered thoughtfully and with integrity. At the same time, as a family who lives this every day, it's difficult to watch the possibility of significant changes to a system we have worked so hard to build our lives around. When your life depends on something working, even small changes don't feel small. And it's hard to understand how large systems changes can happen without affecting that stability like families like ours rely on. We have spent years figuring out how to make this ever-changing disease manageable, how to keep Sam and Alex safe, supported, and able to live with dignity and purpose. As we've read through the information that has been shared by the state, we see words like anticipate, explore, intend, and conduct thorough reviews. And while we understand those words reflect the process, for families like ours, they don't feel like reassurance. They feel like uncertainty. Because our lives are not theoretical. They are built day by day carefully around the system that currently works for us. We are being told that nothing will change for current participants, but at the same time, we're hearing that the program is unsustainable and that cost savings are needed.
reconcile. And when cost savings are part of the goal, it's hard not to wonder what will ultimately mean, not just for today, but for access for others in the future. We've also heard that this transition is about offering more choice, including agency-based care. And while choice is important, our family thrives under self-direction. That flexibility in the program is what allows us to make this work. If the goal is truly to expand choice, it feels like there may be ways to strengthen the existing program by adding options, rather than replacing something that is already working for so many people. And when we talk about the growth of CFC, I would just offer this. That growth reflects people being able to stay in their homes and communities, rather than entering institutions, which is not only what families want, but what is often most cost-effective for the state. To us, that's not a problem to solve, that's a success. And it's very hard to understand how something described in terms of what will be reviewed or explored can truly leave lives like ours unchanged. What families like ours need most is clarity and confidence that the lives we've worked so hard to build will remain intact. We're here today simply to share that perspective, not in policy terms, but in real life. Because programs like CFC are the difference between just existing and truly living your life with dignity, purpose, and choice. Thank you for taking the time to listen to lived experience stories of all the people here today. Thank you so much.
What did I say? A powerhouse team, right? You guys are great. Thank you. Okay, and so up next we have House Minority Leader Vinny Candelora, and he is going to speak also about disability issues and how they are dealing with them and supporting us. Thank you so much.
I just want to thank you all for coming up and advocating for yourselves. I am the fortunate state rep to have Mary, Sam, and Alex in my district. And we have certainly worked on various pieces of legislation, whether it is on handicap parking and the placard issue, or currently on the community first choice that we're all fighting to keep. I certainly could appreciate the efforts that you go through every time the state of Connecticut makes a decision that impacts you. It is far more impactful on all of your lives. And I think it's important for us to be able to hear from you because we don't necessarily have your perspective and how important these programs are to you. I didn't learn about the Community First program until Mary had called me, and that cut was in the governor's budget. And we had a conversation of how important that program is to keep people in their homes and bring as much normalcy into their homes to be able to be part of our communities, not just in mental ways, but in physical ways as well. And so I'm happy to stand here as an advocate for all of you. And just know that we are hearing you, that every time you come up, it has an impact on the decision making in Hartford. So thank you.
Thank you, Representative Candelora. Next, talking about issue with medical accessibility, we do have a bill to allocate some money so medical facilities can purchase DME for lifts or other DME to get people help when they go to the doctor's office. And so speaking about that is Tiffany McDonald. Thank you so much for being here.
ahead of time. When the medical professionals tried to transfer me manually, they dropped me on the floor. Twice. And the whole experience was frightening and painful. We need to improve the diversity and number of lifts that are available in medical facilities and nursing homes, especially as we have more and more aging people with mobility issues. Although equal treatment is an ADA requirement, it is not happening for many patients with disabilities like myself. House Bill 5421 makes a start at addressing the problem. It is not the kind of comprehensive approach that we advocates were hoping for. The bill will provide funding to the Department of Public Health to administer a grants program to which medical facilities could apply in order to obtain durable medical equipment, like mechanical lifts, walkers, commode chairs, etc. Although well-intended, the bill leaves out some key points. Number one, the bill should state that the funds cannot be used to avoid responsibilities under the ADA. A possible amendment would be to say the existence of this fund or the denial or execution grants under it shall not serve to in any way reduce the obligations of entitles under the Americans with Disabilities Act and state anti-discrimination laws. Number two, the only equipment covered by the fund should be mechanical lifts because there is not enough money to cover every type of durable medical equipment. Three, the bill does not make funding available to a wide enough range of healthcare facilities. Many patients with disabilities in nursing homes have to wait to be transferred from their beds because the disabilities have too few lifts. Long-term care and hospital facilities should be eligible to apply for funding. Four, finally, the bill fails to address a related and critical issue, the training of the medical professionals, the medical personnel using the lift to help transfer patients with disabilities. We hope that the Appropriations Committee will consider amending this bill. Thank you.
Thank you so much. You might have seen some signs here about Husky C and the discrimination against it because you're known to go off script. Rick Filiglietti.
Good afternoon. I'm here again. Rick Filiglietti. I get to wear angry red today. Isn't that wonderful? So I want to talk about what's the same for people with disabilities and able-bodied people here in Connecticut. We all want to work, and a lot of people with disabilities do. We also pay the same sales tax, the same returnable tax on the bottles when we buy soda. We pay tax on our clothes, and taxes on repairs for things we have to fix. However, if you're on Medicaid, the difference is we are our income limit to access Husky C is $400 and something less each month than somebody who's able-bodied and Husky D or Husky A. So that is discrimination, right? Yes. Okay. It was 5, maybe 6 years we've been begging this government, not just the lock in the affordable, to raise the income and asset limits for Husky C. 1 year it got in the bill. They were going to raise it. You know, wonderful governor ripped it right out of the bill. What a nice guy, right? So I'm sitting over there with a sign that says, "Why are people with disabilities in Connecticut broke?" He showed it to a legislator, at least I think he was. He looked at the sign. Instead of asking why, he says, "I'm sorry." I started laughing. "You don't want to know why?" And he goes, "Well, what?" So I explained it to him. He says he voted for it, or he's in favor of it, and it should not be in the budget. So I think some of our legislators just don't live in the real world. And for anybody to think that someone can save, we have 2 bills that's going to hopefully raise or eliminate the asset limit. If my income is limited to $100 something a month, I am never going to reach the limit of those assets. Never. Right now, the only way I can save assets is either through a pay trust or an able account. And the able accounts, they started not that long ago, so I'm too far away from the able. I have no savings. Every time I have to fix my house, it goes on a credit card. Because I'm allowed to have debt, but not income. Medicaid Husky C allows you 1 home, private residence, and 1 vehicle. But the income and asset limits don't let you afford it. If you do, you're probably committing fraud, and I've been told never to say that. That's the reality of it, folks. People with disabilities have to find other ways to get by. And this just isn't fair. The governor, I'm also told through other people, he's not good with disability issues or with people with disabilities. So is he one of those people who, when you see somebody in a wheelchair in a store, you look away? You know what? Suck it up. We finally have agrees with him on April 2nd. Let's just hope he listens to us and we can accomplish great things. Thank you.
Thank you, Rick. Next to talk about the wheelchair repair bill and what we are doing with wheelchair repair is Suzanne Garaffa. No, you guys.
Hi everybody again. I'm here for the wheelchair repair bill. But I'm also here with CC=A, Wheelchair Repair Coalition, and Adapt. The reason why I'm here is wheelchair repair is becoming really difficult for me. My chair, has been broken since September of last year. They just gave me a new action. I have a footrest, but I do not keep my feet on the footrest because it's the wrong size. They had to cut my other stuff for my feet to sit back. Due to my spasticity, my feet go out all the time. This is very degrading to me because I have to ask people I do it for a week or anything else that's in the vicinity to bend my legs. And I have to do that at home all times, every day. So Mike Demicco is going to help me demonstrate what happens. Mike? And back in the and I have to do this every day. I have to do this every day, at least 5 times a day. And it's very degrading. So we have to get the wheelchair repair people to give us times when they're going to come get some chairs so we don't have to sit in bed all every day to help them keep going. We don't have to have them keep going. They have to keep going for us. So pass this bill and do business. If we don't keep doing business, swear in. And I don't want to get paid. And this is to you. Thank you.
So Representative Demicco, what was that like to fix your fee on there?
As Suzanne said, it's degrading to have to ask people for help when the right thing should have been done a long time ago. And there are so many wrong things going on here, and that's just one small example. So, as I said, we're not going to get it all this year, but little by little, we're going to make progress, and we have made progress.
Thank you so much. Representative Demicco and Suzanne go way back, so they're friends, but imagine having to go up to a complete stranger and asking and begging to fix your feet. And also, it feels really, when you push her feet, it feels like you're hurting her. And so it's quite yes. Oh, hold on a second.
Sorry, I need to make one more point. Greater Hartford, the one people that put me here every day, my feet come out of my foot all the time. Can they bend my legs? No. If they don't bend my legs, I can't go to Greater Hartford. So it also stops me from doing other things and other times because Greater Hartford cannot bend my legs. So pass this bill. Thank you. And if anybody wants to help, I would like for help.
Okay, so that's SB 501, and the big, what we really want out of that bill is for the two wheelchair companies to tell their customers what their rights are under the law. And so Suzanne knows the law, she knows how to push back, other people don't. And we also want to build a stronger council because we are not, we have no enforcement. So thank you so much. Okay, and next up we have the Executive Director from the State Independent Living Council, Molly Cole, and she is going to talk to us about supported decision making. Thank you, Molly.
So my friend and colleague, Jonathan Martinez, who's our national representative, often asks the question, what's your favorite right? Is it your right to free speech? Is it your right to pick where you want to live? Is it your right to have the friends you want to have? Is it your right to buy the things you want to buy? Well, guess what? Supported decision making is about civil rights. I'm so happy to be part of this Disability Caucus because that's what this is about. It's about this opportunity to make your own decisions. Now, lots of people need guardians. They do, because their ability to make decisions is really limited. Lots of people don't. And yet, we are one of a handful of states now that does not recognize supported decision making. We have 29 states in the District of Columbia, all with legislation that supports this bill. 5485 is our House bill. We are so happy that we finally got a hearing after 9 years. Yes, you are in this for the long haul. 9 years we've been working on this. This may be the year. We hope so. We hope that it's an opportunity to really move this bill forward. And all this bill says is that we will recognize
saving it, and the right to discrimination against people with disabilities in terms of Medicaid financial eligibility in Husky. They are related. Community First Choice obviously is a critical program, and it's an incredible success. And the fact that they're complaining, the governor's office is complaining about it, makes no sense. Anytime you have a successful home and community-based services program to keep people out of nursing homes, it's going to cost money, and that's good because it's less money than in a nursing home. It's a tremendous success. It's illogical to say it's growing, therefore we're going to shut it down. Now, one of the arguments they're making for doing it is, well, you know, we're going to shift people to the waivers. The waivers have higher income limits. It's 3 times the SSI payment amount, currently $2,988 per month, which is good. Higher income limit. But there's long waiting lists. And they say, well, it's not fair that all the people who have low enough income under Husky C, they can get community first choice, no waiting list, whatever, and these higher income people are just stuck on this waiting list because the only way they can get there is with that higher income. Well, one thing we could do is increase the Husky C income limit. As Rick said earlier, $439 less income per year. So basically, Husky C, is the effective income limit is $1,397. Husky A and B for non-disabled adults is $1,836. How is that in any way fair? So the bill that came out of Human Services, we are grateful to Representative Gilchrest and Senator Lesser for SB 1326. We appreciate it very much. But it doesn't address the income $439 a month difference. If we address that, then we can help by making more people eligible for community first choice. It undermines this argument about this people can only get on CSC. That is the solution between the two. And thank you very much.
She was just called to vote. The bell. Oh, what happens? Sorry if I back up you. I'm just trying to keep the interpreter in frame.
Okay, we're just going to change the program up a little because our legislators have gone to vote. This is what we have to be flexible hanging out in the Capitol like this. But it looks like we have someone to talk about community first choice, and I'm not sure anything else. CNT? CNT Raganese, thank you so much.
Hello everyone, I'm sorry I'm reading it right now, so bear with me. I had testified a few weeks back at the Capitol on behalf of the Community First Choice program and not fully leading it. I'm here more so representing, as a mom, I have a young child who's 15. He's been on the program for 7 years. The importance, and I don't think a lot of people are recognizing, is the collateral damage in terms of the cost of eliminating the program. When I had started, when my son was born, he was given a year to live at most. I have fought tooth and nail every day to advocate for him. And honestly, watching every one of you just empowers me even more because I see what you're going through. With my son, I was not able to work. So a lot of times people forget that. When you're not working, you're on state insurance, you're on food stamps, you're on TANF. Forget about the moral, just what that does to you. Just as a parent, with Community First Choice, when we became eligible or when we got on the program, I was able to get back to working. I work 2 full-time jobs right now. My son's dad has cancer. I bust my feathers every day, and this program has been a godsend to us. So the fact that they're thinking about eliminating the program, not only is it disheartening, it's cruel. You have people I know that are here that get up every day that work, that take care of themselves, that have a purpose. And I
much because I truly have learned so much from you all, and realized how much I would have missed out on had I not gotten to serve in this role and work with folks with intellectual and developmental disabilities. And so thank you truly from the bottom of my heart, because it has been an eye-opening experience, and I'm just pleased I get to play a part in trying to make a difference. So wanted to let you know about some of the bills that are working their way through the process, and frame it in 3 different categories. So, we want to ensure that folks who are living with disabilities in our state get to live independently, right? Get to make decisions on their own. And so we have House Bill 5485, which is an act concerning supportive decision-making, which has been worked on for a few years now. And we want to ensure that we get that across the finish line this year. So that will go to the House, and then the Senate, and then to the Governor. We also have an act concerning complex rehabilitation technology wheelchair repair advisory council recommendations. And many of you have been working on that for years, and so we want to move that forward as well. And then the third one is protecting paychecks for personal care attendants and expanding access to state programs, including, and most importantly, saving community first choice.
Yes!
With all due respect to the Department of Social Services, there is no plan. This was sprung on everyone, and I don't believe there's an appetite out of the legislature to do anything to take away community first choice this year, and I will be fighting till the very last day of this legislative session to ensure that that program continues. Then we want to take a look at discrimination, right? We want to ensure that we can make sure folks are not discriminated against. And so we have a proposal, Senate Bill 430, an act codifying the Americans with Disabilities Act. And we want to work on that to protect people here in the state of Connecticut regardless of what happens federally. And then the final piece is overall access to health care and services. And so for years, we have been working to increase Medicaid rates, and we are continuing to beat that drum here to ensure that people can access the care they need when they need it, that providers are paid more than a living wage, but paid what we owe them, the state. And the other piece is protecting those who can't live, right, independently, from abuse and neglect. Because we, for the first time, received a report back from the Department of Developmental Services, and now know to be true that 15 people died in state care last year at the hands of abuse or neglect in a group home, and that is unacceptable. And then you add to that the more than 4,000 people who experienced abuse and neglect. And so we need to do more, we can do more, and so we have legislation to move us in a direction of ensuring that we protect everybody in this state, in particular our most vulnerable. So thank you so much again for educating me, and I look forward to our continued work for the rest of the legislative session to make sure we can get this entire package across the finish line. Thank you.
Thank you, Representative Gilchrest. Thank you, Mike Demicco. Do you have anything else? All right,
Real quickly, I make a lot of noise, but Representative Gilchrest gets things done. That's the difference, and she will get these things done. She is going to work her hardest. So, but thank you. Keep up the pressure. Keep up the pressure. Keep up the pressure.
And none of this could have come together without the help of Safe CFC and especially Adapt who put this whole event together. So thank you so much. A round of